Ready? Okay. So my name is Monica Montag. I have been a clinical nutritionist for 30 years. I'm founder of Be Well Associates, and we've now expanded to include a holistic health coach and other clinical nutritionists. So people are looking for our approach to health. And over the years, one of the topics that I have encountered with clients so frequently is this issue of recurring urinary tract infections. So let's get the first slide up, Annie.
Okay.
Yeah, if you've ever had a urinary tract infection, you know how terrible it is. It's uncomfortable, sometimes downright painful. It gets in the way of your life because you might be constantly having to find a bathroom. And so what we're going to cover in this webinar, just quickly, are the symptoms and what causes bacterial infections and the remedies for those. But what I'm most excited to bring to you today is this concept that bacteria are not the only things that cause urinary tract infections. And oftentimes the problem is simply an imbalance in your pH. And that can be rectified and actually maintained in a normal range so that it reduces your chances of developing symptoms that seem like they're urinary tract infections, but in fact are not. So let's talk about what those symptoms are. Basically, burning, pain on urination, frequency and urgency with very little urine voided. Oftentimes there's a cloudy or there's an odor to the urine. Now, if you are at this stage where there's an odor and the urine is cloudy or dark, or you're having abdominal pain and chills, then it probably is an infection and you should go seek perhaps an antibiotic. Especially if it's getting into back pain and chills, then it might be going up into your kidneys and is a more serious condition. But most often, if it's just the frequency, urgency, and burning, you're still possibly dealing with a problem with pH or a level of infection that you can deal with diet and nutrition. So let's just take a quick look at the anatomy of the bladder and the kidneys. And you can see that in women, there's a relatively short ureter, which is the tube from which we empty our bladder. And then we have these long tubules that go up into the kidneys. So when there is a bacterial infection, those bacteria are most often caused by the class of bacteria called E. coli. And we can go to the next slide, Annie. So you can actually buy test strips at the pharmacy that will tell you whether you have bacteria in your urine. And the most common company is Azo. Now, Azo also produces a medication called Pyridium that is a godsend if you're having severe symptoms. And what Pyridium does is basically anesthetize the bladder. So it's a short-term intervention to help you get comfortable while you're doing all the other things that I'm going to be talking to you about to help you overcome an infection. So before we get into the remedies, I want to talk about what are the conditions that favor an infection. Well, women who are perimenopausal or menopausal often have an increase in UTIs, and that's because of the decrease in estrogen. And estrogen keeps the bladder walls plump and healthy and less vulnerable to bacteria adhering on the walls of the bladder. Now, the same thing happens for our skin. So perhaps you've noticed that if you are menopausal, that the strength and plumpness of your skin on your arms, let's say, or your legs has changed. And that's going to be happening in other parts of your body too, including your bladder walls. So when the bladder walls have thinned out, they become more vulnerable to small tears. And the bacteria can actually take up residence in those tears and then have a place to grow and have a foothold. Believe it or not, something else that increases the chances of that happening are calcium supplements. Calcium makes the bladder walls more sticky. And later on, we're going to learn about a supplement that helps to keep the bladder walls slippery so that the bacteria cannot adhere and you have a better chance of eliminating them through urine. The other potential cause of chronic infections is intercourse. And the reason for that is that the vaginal area is generally slightly acidic, and an acid environment kills bacteria, and that's one of the reasons why our vaginal pH is on the acidic side. Well, semen, or the ejaculate from the male, is very alkaline, so it changes the pH of the vaginal area and can set you up for infections, especially after intercourse. And many women, have realized that there's that connection. So that's a fairly easy correction, in that by using vitamin C, either immediately before or immediately after intercourse, to help acidify the urine, will take care of that problem. Usually that's all it takes. I usually recommend just 1,000 milligrams. And for most women, that is enough. Dehydration is, of course, very important to consider if you are just getting a little behind on your water intake, and that happens 2 or 3 days in a row, or you're not compensating for changes in the environment. So let's say it's very windy outside, which is dehydrating, or you've turned the heat on inside, also dehydrating, or you're traveling, especially air travel, less so now, but hopefully we will have that back. Very dehydrating. So you have to always be aware of, am I hydrated? And a very simple way to tell whether you're hydrated or not is how elastic your skin is. And you can test that. I don't know if you can see me, but you can test that by pinching the top of your hand and letting it go. And if it bounces back quickly, you are well hydrated. But if it's a very slow settling back to, being flat again, it means that you are probably dehydrated. A lot of people have trouble getting enough water because they don't like the taste of it, or it's boring, or whatever, especially if you're having chronic UTIs. Don't hesitate to put a little bit of cranberry juice in your water, just to be able to drink it more readily, to get more fluid in. And we'll talk about cranberry juice probably on the next slide. And then finally, of course, physical trauma can set you up for UTIs, and that's just abrasion. And that can be from intercourse. It can be from tightly fitting pants. It can be from riding a bike. I remember I had a menopausal woman many years ago, and finally we figured out that it was bike riding that set off her UTIs, because the timing was the same year after year, and the only thing that changed was she started riding her bike. So You have to consider that as well. But that can be overcome by caring for the rest of your risk factors. So let's go on and talk about remedies. And this applies to when you actually have an infection. And of course, the earlier you catch and start treating, the better. So of course, cranberry juice, everybody knows about cranberry juice, but there are a couple of details about cranberry juice that are important to attend to. One, cranberry juice off the shell, let's say an ocean, off the shelf, let's say an ocean spray type product, is loaded with sugar. And unfortunately, that can work against you because sugar feeds bacteria. So the ideal way to work with cranberry juice is to get either a concentrate, which you can mix with water and put a little, use a little bit of stevia, for example, as a sweetener, or you could get an unsweetened cranberry juice, and there are some very nice organic products available, and most people need a little sweetener in that too, and you can sweeten it with, let's say, grape juice, a little bit of grape juice. But the point of cranberry is that it's extremely acidifying, so that is going to create an unfavorable environment for bacteria and prevent them from replicating. The D-mannose is the carbohydrate that I mentioned earlier that actually makes the walls of the bladder slippery. And this, to me, has been the most helpful product of all for women who have issues with recurring infections. Oh, by the way, just backtracking to the cranberry juice, 73% of people who use cranberry juice as their only treatment for urinary tract infection-like symptoms. So whether it's an infection or whether it's a pH problem, 73% have relief, which is pretty significant. And a lot of people use cranberry capsules prophylactically. That's another strategy. Uva ursi is one of the herbs that specifically attacks E. coli, which, as I said, is the most common bacteria that causes these infections. But you could use garlic and you could use oregano. Those would also be more general antibacterial agents. We do carry a product called UT Synergy, which comes in capsules and chewables, which contains both D-mannose and uva ursi and some other herbs that actually soothe the walls of the bladder so that it helps to quiet them and calm them, so that, because sometimes it's the spasming that is so painful, the spasming of the bladder walls. So we use the chewables in an acute situation. The capsules are often used for maintenance or as an adjunct to treating an infection for which the person's taking antibiotics. But again, it helps with quieting the symptoms in the bladder. So the last thing on this list is one of the most exciting new developments in nutritional science, and that is the developments of bacteriophages. And bacteriophages are viruses that target specific bacteria. They penetrate the walls of the bacteria and then replicate inside and literally explode the bacterium from the inside out. This product, probiophage, which was developed by a company called Designs for Health, specifically targets E. coli. So it is the ideal probiotic for preventing recurring urinary tract infections. And of course, for helping somebody overcome one if they have it. So there's a lot of development work right now around the development of phages, phage technology, to develop specific phages for specific viruses. I know another one that they're working on right now is to knock out MRSA. So again, it's a virus that would penetrate the bacteria and explode it from the inside. So I think that's very cool. So some of these agents are going to be helping you to get your body in balance to prevent infections. But I think that the thing that is most effective in preventing ongoing infections is to understand the role of pH on the bladder. So pH has to do with the continuum between being acidic and being alkaline. As you know, acid is 0 and alkaline is 14 on a scale where 7 is considered neutral. And every fluid in our bodies has its unique acid-alkaline level that is appropriate. One thing that's very confusing, however, is that a food that tastes acidic in the mouth, such as lemons, actually breaks down after metabolism into an ash that is alkaline, has an alkaline effect in the body. So you can't automatically assume that something that is acidic, like citrus fruits, is going to irritate your bladder, because it won't. Whereas, as we'll see in the, well, we won't see it in the next slide yet, but I'm going to tell you how you can measure your pH, and then you can start tracking it and managing it with your diet. So in this case, we're interested in evaluating your urinary pH. Sometimes we are looking at salivary pH, but not today. So what you need to do is buy a little roll of pH paper, and we should have a picture of that in this presentation, because it's a relatively narrow range of a pH of 5 to 8, okay? pH paper comes in all different ranges. And you just tear off a piece of the pH paper and hold it under the stream of urine first thing in the morning. So before you eat or drink anything, get that first morning pH of your urine, and then compare it to the color of the strip on the reference chart. And what you're looking for is an ideal pH of 6.4, okay? If it's higher than that, then you are too alkaline. If it's lower than that, then you're too acidic. And so let's look at the chart of, there's the ideal pH is 6.4, and you can see the ideal pH for saliva is higher, right? So in this case, we're focusing on the 6.4. Okay, next slide. This is if you're working with both your saliva and your urine, you can use this chart to figure out what you need to do. I will tell you that the vast majority of people need to increase their fruits and vegetables. I have never, ever encountered anyone who's measuring their pH who needs more grains, and very few that need more meat and eggs. It's mostly the fruits and vegetables, and sometimes fats and oils. Okay. So on the next sheet, you can start to understand which foods would support an alkaline environment and which ones you want to minimize because they create the acidic pH. And most people are too acidic, okay? And think about it, having acidic urine irritates the bladder, but also having overly alkaline urine can also irritate the bladder because overly alkaline substances burn as well. So you think about lye, which has a pH of 14, which is on the extreme end of the alkaline scale. So if you're looking at ways to alkalinize your urine quickly, one of the best ways to do it is using baking soda, table salt, or mineral water. And you know what? Those are not on this chart.
Which chart would you like to have right now, Monica? I have the whole.
Actually, it's the chart we use in the office. So let me see the next one. Let me see the next one.
I have the acid chart in 2 slides.
Yeah, right. So this doesn't have the same information on it than the chart that I'm working. Oh, no, it does. I'm sorry. Here it is.
Would you like to see the alkaline side?
No.
Here we have table salt is listed here.
So table salt, you know, this, I'm so sorry, this chart is incorrect.
Oh, tell us.
It is incorrect. Yeah, the chart that I like to use is from Dr. Russell Jaffe. So I'm just going to give you the highlights of this chart, and then we will send you the correct chart. It's not as pretty, and that's why I chose this one, but I didn't look at it closely enough.
So really, right now we're looking at becoming more alkaline, right?
Yes. So if you are too acidic, then the most alkalinizing substance is baking soda, table salt, and mineral water. Mineral water because of the minerals, right? They're alkalinizing. So as a quick fix, if you're having symptoms of a urinary tract infection, such as, well, you know what they are, one of the things that you can try to test out whether you're too acidic or too alkaline and which direction to go with your diet is to take a half teaspoon of baking soda in water and drink it and see if you have a decrease in your symptoms or an actual increase. So if the symptoms decrease, then you can take baking soda in water for up to 3 days. You don't want to keep that up for too long because it will affect your digestive enzymes in your stomach. But for quickly turning around the symptoms until you can correct it by drinking a lot of water and using the D-manos and some of the other techniques, you can use the baking soda.
So Monica, I just want to clarify. So the chart we're showing now shows mineral water and sea salt and the baking soda. And you said a half a teaspoon in a glass of water?
Yes, a half teaspoon in a glass of water will alkalinize you quickly.
And for using the sea salt, would we just...
Actually, I do have that recommendation a couple of slides ahead.
Yes, and how would we use the sea salt? Again, in water?
Well, the sea salt is a little harder to use because it is, I mean, the baking soda is very salty. The sea salt would be even more so. But it just depends on what you have on hand, okay?
Okay.
Let me also just add this little detail. If you decide that you want to use the Peridian product, which I mentioned early on, the downside of that is that it does dye your urine very bright orange. So then you would not be able to evaluate the pH of your urine. Then you would just have to, you know, drink water and cranberry juice and use the D-mannose to flush out whether it's a bacteria or whether it's an imbalance in pH. But here's something interesting. The reason why this chart is incorrect is because they listed antibiotics kind of randomly as a therapeutic category, but antibiotics are extremely acidic and acidifying. And so for many people who have a pH balance that is too alkaline, the antibiotics are curative. It's not that they needed the antibiotics, it's that they needed to acidify their urine. So it feels like it got rid of the infection, but then they're taking antibiotics for a 10-day course without really needing it, because they could have gotten that same result by the cranberry and by taking high dose vitamin C. So, generally speaking, for overall health, it's a good idea to have most of your diet, 80% of it, be in the alkaline category, and then 20% of your foods be in the more acidic category. So you can see that the alkalinizing foods are mostly the vegetables and the fruits, whereas the acidifying foods are the grains and the meats. And of course, the most acid of all is sugar, vinegar, beef, dairy, soy, fried foods. And so, you would use those in moderation. Okay.
Monica, I just want to suggest that we just take a moment and just see if anybody has any questions so far.
Okay, that's good.
Everybody's muted, but if you need to ask a question, you want to unmute yourself and ask, because that's a lot of information about foods. Okay, while people are thinking about it, I actually have a question that I want to ask.
Yeah, sure.
So I'm confused about cranberry being on the acidic side, but I don't understand how, if I get an infection, I'm getting it because I'm too acidic and I need to be more alkaline? No.
No, not necessarily. So you can get an infection just because you have an overwhelming amount of E. coli that have gathered in your bladder because you're chronically dehydrated, or later on we'll see you're wearing nylon underwear that doesn't breathe, or there's trauma to that part of your body and there's irritation, or the walls of your bladder are so fragile that any amount of bacteria will, basically climb in those little pouches and stay there and grow. So the infection can be independent of your pH. But if you're overly alkaline, that actually increases your risk of developing an infection. So that's when cranberry juice and vitamin C come in, because they're very acidifying. And so those are the infections that are related to intercourse because of the alkalinizing effect of the semen.
Yeah, great, thank you. Did anybody have any questions? No? Okay.
Okay. All right. So basically, that was the discussion that I wanted to share with you, because I feel like the pH piece is missing for so many people, for so many women in particular. And if you tend to get infections, then get yourself some pH paper, start measuring your urine, manipulate it with food or with baking soda for a short time, make the correction using some of the food choices that you have, and perhaps consider using one of the supplements on an ongoing basis that will help you prevent infections, or prevent the irritation that you think is an infection but may or may not be, because of a pH imbalance. Generally and yes, balancing body chemistry takes time, and basically because for most people it means eating more fruits and vegetables. It's really a huge lifestyle change. It can be. By the way, one of the nice ways to include more fruits and vegetables in your diet is to use a green drink of some sort. You can get a green powder that's made up of many fruits and vegetables concentrates that have been dehydrated. You can drink chlorophyll, straight chlorophyll. There's some products out there that taste very, very good. Anyway, there's a gazillion ways to increase your greens. So I just wanted to finish by saying that I always like to address the mind-body connection. Not just, if you have a random infection once every 15 years, that's different. But if you're having chronic infections, then you might want to consider that there's an emotional component. And Louise Hay, who was a psychotherapist who frontiered the mind-body connection, connected UTIs with feeling pissed off and tendency to blame others. So she was very big on affirmations, as am I, because it's a good way to reprogram the patterns in our brains. The affirmation to turn that around is, I release the pattern in my consciousness that created this condition. I'm willing to change. I love and approve of myself. So some best practices that you can incorporate would be staying hydrated, wear cotton underwear, no tight pants, try to avoid bubble baths that are chemical agents. There is a product out there that's actually safe for bubble baths. It's called Basic H. It's an old Shaklee product, and it has an alkalinizing effect. So it's the same pH as the skin, so it's very safe for this sort of, if you like bubble baths. Track your pH and adjust your diet according to your body's needs. So thank you for joining us, and if you would like to talk about your own needs specifically, the best way to start a connection with Be Well Associates is a 15-minute free phone consult where I can talk with you about how we might be able to help you. Thanks for being with us this morning. And let me know if you have any questions. If you think of them after the fact, you can email me at monica@bewellassociates.com. Have a wonderful morning. Bye-bye.